Então, gente, vamos começar. Vou começar com uma breve introdução em português, mas a gente passa para o inglês daqui a pouco. Então, como vocês sabem, a gente vai ter o nosso último Meetup de 2020, despedir desse ano atípico, para ter o nosso fresh start em 2021, esperançosos em todos os sentidos. Tivemos aí muitos aprendizados, muitas lições, muitas surpresas no ano de 2020, mas também que nos preparou para sermos pessoas melhores, profissionais melhores, para enfrentar novos desafios que virão, com certeza. Então, é com grande satisfação que a gente tem uma convidada super especial, Zeina Afif. Now I'm switching to English. So we're very glad to have Zeina with us today to close our meetups. We had, how many meetings we had, Artur, this year?
8 or 9?
8 or 9, okay. So
online, yeah.
Online, yes, that's true.
Yeah,
so
okay. This is our edition 22 ever.
Edition 22. We had 8 or 9 together, Brasilia and São Paulo, which has been, I mean, one of the good things about the pandemic is, I mean, working together with Artur and Guilherme and Flávia, of course, so Bsb-EConomics and the Meetup from São Paulo. So I'm very excited, we're all excited to have Zeina here with you. Zeina is going to talk about behavioral sciences in general. She's going to talk about the second edition of the World Bank's report, Behavioral Sciences Around the World. And of course, she will talk about the challenges, behavioral challenges regarding the vaccination coming very soon, well, already started in the UK and Russia against COVID-19. So I'm very pleased to introduce Zeina. Zeina is a senior social scientist at the World Bank, working at the Mind, Behavior and Development Unit. She currently works on applying behavioral insights to improve women's access to finance and jobs, reduce youth unemployment, reduce gender-based violence, promoting social cohesion, and improving access to public services and programs in the Middle East and North Africa, as well as Latin America and in the Caribbean region. Zeina holds an MBA from the George Washington University and a Master's in Sciences in Behavioral Sciences from the London School of Economics. So Zeina, welcome. It's a great pleasure to have you with us. So the floor is yours.
Thank you so much. And it's a great pleasure to be here and to be at your last session for this meetup. It's great to be also surrounded by many friendly faces, and I look forward to meet also some of the new ones. So I'm gonna share my screen. So, oh, it looks like it's disabled for me to share it.
Oh, let me fix that. I'm sorry.
Okay. Okay. So I thought, like Juliana mentioned, I'm just gonna, I know most of you are very familiar with behavioral science, but I'm just gonna quickly go through kind of our approach to behavioral science because it's gonna come up later, and then share with you like some of how international organizations and development agencies are applying behavioral science, integrating behavioral science in their institution, and then talk more about COVID in general and vaccination.
Perfect. It's all fixed now. You're good to go.
Excellent, excellent, great. Let me see if you guys can see. Can you see the PowerPoint?
Yes.
Yes.
Okay, excellent, great. So let me. All right, so we talked about what the agenda is going to be. So I'll jump quickly in. We all know that making decision is not as straightforward as we see in this image, that if you want something, we just do the action we need and we get the outcome we want. But there's, it's really more looks like this, and there's a lot of psychological barriers and different challenges that we face in making decision, whether it is our own motivation and then also the people around us, as well as how easy it is to actually do this decision. And the World Bank developed a framework on behavioral economics in 2015 in the World Development Report, which is one of the World Bank reports. Every year they have one on a specific topic. And just to show how the World Bank as an institution regarded behavioral science as important, they dedicated 2015 for that report. And if you haven't seen it, we can share it afterwards in this presentation. What I really like about the report is the framework they produce on how people really make decisions, and that's how we think automatically. So we rely on mental shortcuts, we think fast, so system one most of the time, how we think socially, so we are influenced what people around us do and what we think they expect us to do. So the role of such social networks and norms affect our behavior and our decisions. And then we think in mental model, which means we are really we view the world through filtered lens, because based on how we have grown up, our shared history, our experiences, we filter the information and then we apply that lens on how we see the world. And a lot of the policies, when they are programs, when they are designed by government, they think that people are going to make deliberative decisions, that they're going to make selfish decisions, they're not influenced by other people, and that they are objective. And I always find this funny, because objective for whom? The policy designer versus the individual, because we all have our own perceptions. But anyway, so that we see it objective, the world as it is. And what we are saying is that on top of this, you need to apply, behavioral lens, and need to take into account that people are going to think automatically. They're not going to carefully weigh in all the information. They're going to rely on heuristics and shortcuts. They're going to think socially. Even though they actually may not be in their benefit, they're not going to do it if others are not doing it. And they're going to think in mental models. So they will use beliefs and perceived ideas on how they're going to interpret information or programs. And while the standard policy tools are providing information campaigns, awareness campaigns, as well as education, also providing incentives and prices or subsidies, or even enacting laws. What we're saying, these are not enough. For some things, you have to leverage behavioral policy tools. That includes use of the false, use of role models, mindsets, and others. So as the World Bank Behavioral Science Unit, we have around 30 plus staff and consultants and partners that work on our portfolio. We have over 80 ongoing engagement at the moment, and we've completed many others. And again, as you probably already know, we rely a lot on local expertise, to help us implement projects, especially when we are working on. We have big portfolios in some countries, but even for smaller ones, we really rely a lot on local expertise to work with consultants and partners to work with us. And we pretty much work in every single policy area. I think the list could be very long, and I'm not going to bore you with it right now, but pretty much every policy area we're working in it. And one thing about how we work, we're very much context driven. We do invest a lot of time upfront to do a proper definition and diagnostics of the problem. We are also rely heavily on evidence, and not just because we test our insight, but we use basically evidence-based research in the diagnostics phase, in the design phase, in the implementation phase. We use evidence, and we also test ourselves. And the way we work is very much iterative, as in we adapt as we are getting more insights. And some of you may already kind of seen this, but this is kind of the cycle we work at, where it summarizes our behavioral approach, where we, again, spend a lot of time identifying the problem and behaviorally terms, and then collecting background information and available data, whether it's through secondary data available, or we go collect data ourselves through focus groups, surveys, or household surveys, interviews, any mechanisms possible we tend to use and whatever is feasible. We tend to do a lot of field work to kind of develop a behavioral map of what the experience is going to be for the target groups and the bottlenecks that they're going to face. We move then to design. We usually come up with a multiple list of interventions. Some of them are very much built on evidence. The other one are really crazy ideas that we'd like to go out there and test because we think it might work. And then we narrow down to what's more feasible. And it doesn't mean that we are always implementing the best idea. Most of the time we're implementing the most realistic idea based on what's the easiest to implement, what's going to be the most acceptable by our government partners, and while giving us results we need. So we don't function like academics where they want to design the best potential intervention and test it. We very much have to deal with the realities on the ground and the authorizing environment, and also what's possible with the different partners we have. And we try to do at any time we can, we do RCTs, any kind of experiment, a quasi-experiment even if needed, whatever we can to really evaluate our interventions and see what worked, what did not work. And from that, we move towards identifying key learnings, and then further areas, identifying further areas we should be working in, we tweak the programs, and then we go back again. So we truly believe in this kind of iterative process. And just one example of a behavioral map of how we work is, we've been doing a lot of work on tax compliance from Guatemala to Kosovo to Indonesia. We have a large portfolio around tax compliance. And as you can see from the behavioral map, we break it down to each step that the individual will have to take, and we identify different barriers. This looks very pretty, the original behavioral maps, as the ones that the colleagues that work with us, though they don't really look like this. We spend a lot of time and effort to make it look really attractive and clear and simple to understand, because at the end of the day, we might have a report that diagnoses the problems, a 50-page report nobody's going to read, but everybody understands this infographic and understands the barriers. And when we do the interventions and we implement our solutions, again, this is where the diagnostics is so important, because we saw what people reacted to in Guatemala on tax compliance was not the same as in Kosovo, was not the same as Indonesia, and then in other countries. So that's why doing this diagnostics and testing is so important, because you actually don't know what's going to work in the context. You have assumptions, but until you go out there and test it, you don't know. So that's why we also believe a lot in testing. So behavioral science and public policy, where are we at? This two years ago, there were 200 plus public entities all over the world. This is from the OECD map, which I'm sure all of you are familiar with. I bet you right now it's at least 400, if not more. It's been 10 years, so this is the anniversary since the establishment of the Behavioral Insight team in the UK. And they've just published a very nice report where they highlight some of their greatest accomplishments and work. And it's been 5 years since we've developed the World Development Report on mind, society, and behaviors. And if you've seen our first report, Behavioral Science Around the World, we profiled the first 10 countries that have adopted behavioral science, including the UK, and how they've evolved through the process. And as Juliana mentioned, we just published a report, Behavioral Science Around the World, Volume 2, where we wanted to look at organizations that worked in development and aid agencies and see how are they integrating behavioral science, and what are some of the lessons learned from them. And a lot of them are not necessarily, unlike country government teams, these are teams like the World Bank that work with government or local clients. So we are implementing interventions in different countries, at different contexts, which makes a big difference and creates a different complexity to, for example, what the government countries are doing, government behavioral insight teams are doing in different countries. So we really wanted to know how they are approaching it. And in the report, you'll find more than 170 insights from how they've used behavioral science. And some of the organizations that are featured from the European Commission, DFID, which is now called, I have to read this up, UK Foreign Commonwealth Development Office. Yes, so which is the new DFID, GIZ, which is the German implementing agency, IDB and Red Cross and others, as well as the World Bank. And I'm not going to go too much into details, but you will see in the report what we do. We describe how each organization adopted behavioral science, how they are structured, number of staff, kind of skills that they are looking for or they hire, and examples of the completed and ongoing work. So there's a really nice details to the different organizations and how they've basically adopted behavioral science. And you can see, for example, a lot of great illustration of work around changing attitudes and mindsets, whether it's around school attendance and performance, positive parenting, gender equality. There's also a great work being done around increasing health and safety, around hand washing, breastfeeding, and then reducing intimate partner violence, and also prompting efficiency and program delivery and practices. So some of the key takeaways for us from the second report is that a lot of these started off as a proof of concept and needed to demonstrate the value of behavioral science, especially since a lot of them, you know, half of them work in developing contexts, which is very different than where the first 10 countries had been working, where you had really great citizen to touch points with citizens, systems, data, admin data you could leverage. You know, a lot of these development and aid organizations really working with countries where there's very little data and really weak touch points with the citizens and consumers. So this is something that, you know, created, and also they work in really complex contexts like, you know, fragile and conflict, such as Iraq and Afghanistan and others. There's also increasing, there's been entities, basically the profile of behavioral science has been being raised in the different organizations. And what's really, even though it may have started organically, having senior level championship has really kind of helped elevate the program. And I think by the time we've done the report, things have really established a lot more than if we had started this report when we actually did start the conversation with a lot of them a few years ago. Even for us, for the World Bank, we were really established in 2000. I think we started, the unit was actually officially established in 2017. And then what's really great is there's a lot of global networks, and there's increasing collaboration and connecting with different behavioral insight businesses like IDs 42, BIT, and others, Dan Ariely. But also that there was a lot of networking going on and knowledge sharing among the different organizations, which is really what I love a lot about this field. And also one thing is there's a growing attention on measurement and evaluation and adapting things at the context level, which is really great because, you know, as you will see in the report, you have UNICEF, USAID have done phenomenal work on behavioral change communication campaigns, you know, but there's very little evaluation, there's very little evidence whether these actually work or not. They change behavior, they change attitude. So seeing them adopting behavioral science and adopting more rigorous evaluation approaches I think is going to be great, because we need more evidence to know a lot of these expensive interventions, whether they actually work, and if not, how do they need to be tweaked to work. Challenges that they face is that, again, there's limited depth of intervention. A lot of times it's piloting, it's small testing, and the ability to scale up is very hard just because of the nature of the kind of programming it's done. You know, they work with an NGO, they work with a government, it's for 2 to 3 years, 4 years, and then that engagement ends. So the scale up isn't always there, you know, mostly because of the relationship with the government or the partner, financial, staffing, and really the time that is needed. That's why, you know, really the government implementation is a great space to see scale up, because they're able to actually evaluate long-term impact of these interventions, versus a lot of, you know, even for us, the World Bank, our engagement with the governments are usually, you know, 2 to 5 years max. So that doesn't always provide us the space we need to do the kind of scale up and evaluation that this field needs. There's a lot of changes in the field, and there's a lack of standardization. We're still seeing, you know, that's one thing that I'd like to see more, is more standardized toolkits, products that help a lot of the people implementing behavioral science to quickly keep up with the latest research, especially when they are working within different units in an organization with many departments. And that's why, like, you know, like the COMBI framework is a good one. I think the EAST framework, there's also the Mindspace, the one by BIT. There are some good frameworks there, but I think we need a lot more. And we, the World Bank, are working on one on behavioral diagnostics, because as you probably heard me emphasize now, we think diagnostics are very important. Okay, I'm running out of time. I'm just realizing. Okay, so so I'm going to kind of skip to the COVID and the behavioral science section. And when we first worked on this report, it was, we started this report last fall, but by the time we were finalizing it, we were in the middle of COVID. And a lot of the units you will see have asked to incorporate some of the work they're doing on COVID. They've had to either pause their work, they were constrained by access, or they basically leverage the actual project they have to address COVID. And so what's really the question I asked, the behavioral science, is behavioral science helping COVID-19? Can it help COVID-19? Or is COVID-19 helping behavioral science? And I think it's both of them. It's great to see the WHO basically put the statement in May saying how important behavioral science is going to be to inform the planning and appropriate pandemic response measures. And I think that's really helped elevate the profile of our work of behavioral science. And they even established a technical advisory board with Constantine and other on the board to basically advise on the COVID response. And what we've seen when COVID basically started is most of the effective interventions are behavioral interventions, whether it's hand washing, social distancing, wearing masks, getting tested, contact tracing, or travel restrictions. A lot of these have to be behavioral interventions. And some examples of early work that was done in BIT. So the nice thing with COVID is, and the behavioral science community, is that they were very quick to go in and try to test and try to advise governments and entities on how to respond. And there are some great examples from different countries where they were able to do a lot of A/B testing of some of the messages. The UK BIT team ran an online experiment in mid-March with around 2,600 UK adults, where they tested 7 posters from UK, Singapore, Italy, South Korea, Spain, Taiwan, and the WHO. And all 7 posters were showing how to wash their hands in a procedural step-by-step way. And then participants were randomly assigned to C1, and then they were asked a series of questions. And what they found is that 3 of the designs were effective in people remembering the key messages and rating them positively. And these are the 3 ones. I believe it's from South Korea, it's the UK, and Thailand were the most effective one. And what was good about them is that they use bright infographic design with step-by-step procedures for thorough hand washing prominently and without having too much text. Now, so this is in the UK. It'll be interesting if the same test happened with the 7 posters in the other countries. It would be interesting to see if the same 3 posters would be selected or not. Another examples of use of behavioral science in the COVID response is around social distancing. And Ireland did a great study when they basically did some online survey to see what has been the most effective way to encourage people to social distance. They did a survey with 500 adults, randomly assigned to different of the treatment groups, to see basically which one was the most effective. And so basically what people found is, so you had one that was more informational framing, status quo, and then the other one was focusing on transmission rate of framing. And then the one that's behaviorally informed really had more emphasis of 1 out of 5. This one had 1 out of every 5. Wait a second, sorry. So basically this one was the most effective, and what's been very effective about it is that it had people, it was relatable with identifiable vulnerable people that people can see within their own community, whether it's an elder, whether it's a friend, whether it's you know, your colleagues. So that's was what made it one of the most effective one. And then also there's been interesting work on mask interventions, to promote wearing masks. So my favorite example here in the US, it was a very much behavior-informed, localized communication campaign using social norms. And this really appealed to the Montana population and spoke to what their lifestyle is. And that it's, and then so you can see these are very manly activities, very much, you know, gives a visual of, like, you know, strength and risk-taking, and even with that, they do wear face covering. So that's a good example. And there's been some interesting also evaluation you can find on the different kind of mask intervention that has been effective or not. And then most of you, I assume, are familiar with the growth mindset work from Carol Dweck. So we've been working with the Peru government for many years now on interventions on doing growth mindset, on integrating growth mindset videos into the classroom. So what happened is during COVID, it was scaled up to 12 and 13-year-old nationwide as part of the Peru's remote learning curriculum. Unfortunately, I don't think it's being evaluated, but it also shows you how, you know, leveraging even previous interventions, you know, and people moving online and remote learning allowed us to kind of really expand this intervention widely. So now, what about COVID vaccine rollout? So a study, so vaccine hesitancy is a known problem that's only been increasing, and it's been identified by WHO as one of the top 10 health crisis, global health crisis. And the way, if you could look at different countries, it's really, it fluctuates. You have some countries where there's a lot more vaccine acceptance versus others where there's not. So in a survey done, and there's a lot of studies measuring vaccine hesitancy, and in this survey done by Ipsos, you know, where they measure different countries, you can see that you know, a lot of the countries vary, where, you know, you have a lot more in South Asian countries, you have a lot more vaccine acceptance, and versus in Eastern European, in Europe, you have a lot less acceptance. And what I think it's important to note is that these change, they're not constant. So these numbers are really like moving targets, and different studies have been done across different times. And you see that, you know, it's been fluctuating. And this is an example in the US where actually vaccine resistance is a big issue. You can see how based on political alignment, how vaccine acceptance has shifted between May and September. So there's also been another meta-analysis and systematic review across 13 countries, and they've seen that, you know, while 16% of countries, 16% of the populations intend to vaccinate, 20% intend to refuse. And that's an issue, because for some countries, when you're going to need to get herd immunity, you need to get at least 80% of the 70 or 80% of the population vaccinated. You know, if you have a large number of vaccine resistant or vaccine hesitant, then it becomes an issue. And some interesting from that meta-analysis that was done is that being female, younger, and lower income or education level, belonging to an ethnic minority were consistently associated with being less likely to intend to vaccinate. So we took a closer look to Australia, where they've done also a longitudinal survey around 3,000 respondents of all the states. And what you can see here is that the you know, vaccine resistance is pretty low, it's around 5%, as well as the, you know, they broke down vaccine hesitancy to high versus low. So the vaccine resistant and the high levels of vaccine hesitancy tend to be kind of like the challenging, hard to change their mind groups versus the low level of vaccine hesitancy and definitely getting vaccine. So the good news for Australia is that they pretty much almost have 60% that are definitely, willing to get the vaccine. But when they looked into who is hesitant, and in Australia, it was women, it was people over versus male. Female were more hesitant than male. People over 55 and over more hesitant than younger. People with lower level education more hesitant than those with university degrees, and people in the fourth most disadvantaged quintile versus higher, even the third. There was a difference between the fourth and the third. People with less income, household income versus those with higher. And then another interesting they looked into is how does it correlate to people who adhere to COVID prevention measures, whether it is social distancing, wearing masks, and people who are resistant and hesitant groups tend to actually not adhere to COVID-19 prevention measures. Another interesting thing is that they tend to be religious, they have more populist views, they are less supportive of immigration, they have lower trust in government and health services. So this is just to give you an idea of when you drill into a country specific. So what the World Bank is doing, the bank has prepared a $12 billion in financing packages to low and middle income countries. They're helping the countries to, through the support readiness to deploy the vaccines, address any challenges, and make sure it's delivered fairly, efficiently, and safely. And what we are doing is we're providing support through behavioral science to provide country-tailored guidelines on communicating vaccines. And the way we're doing it, we're doing three things. The first thing we're doing is online survey, social media survey to capture current beliefs, attitude, and expectations towards vaccines, trust in institution to deliver the vaccine, understanding around access. Once we've finished the surveys, we plan on doing country-specific A/B testing, whether it's around information, commitment, edutainment, messenger, to basically let us know how messages need to be prepared, tailored to different audiences in the different countries. And after that, we'll provide the communication materials and guidelines. So our survey has 6 sections. The first section, which we are piloting it actually this week, looks into demographics, whether it's location, gender, marital status, income, education, household composition. We're looking into vaccine behavior and such as prior immunization, knowledge of COVID vaccine research, vaccine intention, vaccine delivery location preferences, where would they like to take it, and then do they usually vaccinate their kids. We're also looking into role model and trust. So which are the trusted sources for health information? Maybe it's the pharmacist, the doctor, is it the Minister of Health? So we're trying to find out, and also who are some role models that can influence on vaccine intention. We also are asking around concern and hesitancy, and whether it's around, would altruism work? Is it more about trust in vaccine information? Is it around religion? Is it around COVID vaccine questions? So we really want to know which areas are the bigger issues. We also want to know around social norms. What are the empirical norms expectation? What are the normative social norms expectation? And then also we're tapping into locus of control as well. And finally, around COVID-19, we are looking into what have been their prevention behavior in the past. Are they aware of the communication campaigns? And do they perceive, how do they perceive the government effectiveness effectiveness of the COVID response? And so once we basically do this analysis, we'll be able to kind of start thinking of what kind of interventions we want. So we started thinking through what are the barriers to vaccine, and this could evolve and change based on the different contexts you're dealing with. But most of the research say that around biases, optimism bias plays a role. You have younger and fitter adults who may consider themselves lower risk, and if bad things also can happen to other people, but not to me. Then there's also omission bias and status quo. If I don't do anything, nothing will happen. So it's kind of in denial. There's also availability and bias. So if I see things in the news that the vaccine is bad. I may decide, it takes one bad review of the vaccine to get people to want to take the vaccine. And if people around me are not, are negative around the vaccine, it may also affect me. And then there's also the friction, how difficult it's going to be for me to get the vaccine. There's also thinking socially. So what are the social norms? What do people around me believe or do? Is there a fear of stigma? If I get vaccinated, does that mean I was vulnerable? How is that going to reflect on me? So these are kind of things that are going to affect individuals' decision to take the vaccine. And there's also thinking with mental models. What are my beliefs around vaccines? Maybe in general, I'm against it. Also, do I trust the government and the health system in general? These are all going to affect people's willingness to take vaccines. So the WHO, you may have seen, has put out the technical advisory group on behavioral science just put up a couple of days ago some guidelines on how to prepare. And what they're saying, basically focusing on three things, creating an enabling environment to make it accessible, easy, and access to the vaccine easy, quick, affordable, harnessing social influences. So who are the people that are trusted by and members of the community that can support this, and also increase motivation through open and transparent dialogue and communication about uncertainty and risk. And this is a big issue because we're going to have a lot of uncertainty. I mean, we don't have a lot of information that we usually have around vaccines about its effectiveness, side effect. We're learning as we go along. So this is going to be very important to be very transparent and clear about what we know and what we don't know. So what are some possible solutions? Obviously, make it easy and accessible. So thinking through the process that individuals have to take to get the vaccines. Where do you place it? Is it going to be hospitals? Is it going to be doctors' offices? How is it going to be in pharmacies? So what's going to be the process for me to get the vaccine? How easy it is and how accessible it is? And make it social, promote positive social norms. If more people are taking the vaccine, if there's vaccine acceptance, emphasize that. Of course, don't emphasize, which the media always does. It emphasizes how many people are not willing to take the vaccine versus how many people actually are willing to take the vaccine, which is really important to emphasize the positive norms. And also leverage reminders, default, and planning prompt. But also using effective messenger, which is trusted by the community. So this is, you can see how Obama, Bush, and Clinton, just the three previous presidents for the US, basically said they were willing to get the coronavirus on camera. That's great, but is that everybody? And are these the people who tend to be against the vaccine or hesitant around vaccine? Are they the one listening to Obama, Bush, and Clinton? Do we need to get Trump to take the vaccine on TV? Do we need to get, if it's religious, do we need to get the churches, basically the clergy to take the vaccine on camera? So who is going to be the trusted messenger by the communities that you're trying to target that would be effective? So which would be the effective messenger? And there's really interesting work around how to address misinformation and disinformation. And there's interesting research around inoculation theory, which is basically you want to get ahead of this. You want to pre-expose people to a weakened version of whatever this belief is, whether it is that it's going to make you sick, whatever it is that is going to be the challenge. Prepare people for this argument in advance before it becomes an issue. And that requires to be very proactive in the communication campaign. And then also it has to be, a multi-component and really trying to create a dialogue-based intervention, getting at the communities that are going to be the biggest challenge, getting down to the community level and leveraging things like human-centered design to be able to get consensus and agreement on how best to design effective communication campaign or even roll out the vaccine. And one thing we've also looking into doing is leveraging entertainment to increase awareness and change behavior. And this is just an example of how the BBC radio program did in, I think, 2013 around to increase child vaccination uptake. Now, this was qualitatively evaluated, so it's not a true RCT, but or evaluation, but it showed promises. We are at the World Bank doing a lot on edutainment and for behavior change, whether it's on gender-based violence and also on malaria. We just finished doing intervention on malaria in India, and we've had some really good positive results by using edutainment and through social media such as Facebook. So this is definitely an area that is growing, and right now with the online, most people being online, really leveraging edutainment through social media could be one way to reshape kind of the communication campaigns and really targeting it there. But it's not just about vaccine take-up. There are other things to keep in mind where behavioral science can support. How do you ensure proper transfer and storage of vaccines? You're talking about the whole process-wise, and how do you address potential barriers there and problems, bottlenecks? How do you encourage positive behavior by health workers? We are assuming health workers are willing to take the vaccine, but what if they're not? Actually, I've had interesting conversations with doctors I know who said, I wouldn't take a vaccine by this pharmaceutical company. I will only take it if it's by this pharmaceutical company. So you also have to work with the health workers and also prepare them on being able to also have these conversations with the beneficiaries and individuals around vaccines. And there's also, if there's going to be some of the vaccines require 2 dosages, so you need people to come back to take the vaccine. That's going to be also another thing that's going to be behavioral science can help. There's also managing expectation when there's high uncertainty and incomplete information regarding vaccines. So this is where, you know, a clear communication, managing expectation, and in simple terms, educating people around the process of why, you know, this rapid way of developing vaccine is as effective as the past developing, you know, the flu vaccine in the past. And also, you know, how are we going to get people to continue practicing, you know, COVID prevention methods? Because even if people took the vaccines, it doesn't mean they cannot, it's going to take time before you have herd immunity. And not only that, you know, it's still not known whether you may not get symptoms from the COVID symptoms, but it doesn't mean you cannot pass it. So there's still a little bit of unknown whether you can still be a carrier of COVID, even though not have symptoms once you've taken the vaccine. So there's still a lot of unknown that we need to answer, where behavioral science can come in. And just to basically kind of close up on what's next for behavioral science. First thing is we really believe, I mean, diagnose. We really believe in conducting thorough diagnostics. If you see any of our work, you know we spend a lot of time doing diagnostics. It really frustrates some of our management because everybody wants to see quick results, but we truly believe in diagnostics, doing thorough behavioral diagnostics. And leveraging also human-centered design. This is another area. So a lot of behavioral science, when you do the diagnostics, is the way we go and collect information and come back. Well, you know, how do we adopt a lot of the human-centered design approaches? How do we actually do diagnostics with the targeted communities and the other stakeholders versus just us going collecting data? So how do we involve them more in the design of the solution versus just, you know, hearing them out? Also, you know, leveraging behavioral science research, you know, using evidence, not just, you know, using evidence throughout the whole process. So not just using it when you're doing diagnostics, when you identify the solution, when you're testing the intervention, really leveraging evidence throughout the whole process. And then also, you know, embedding experimentations in the design and rollout of programs. I know doing RCTs can be expensive and take a long time. Do A/B testing, do anything to be able to just see, you know, what would work and adopt kind of the design, diagnostic design, test and learn mentality. And then, of course, for us, we want to see getting to scale. We want to see a lot of this work being scaled up and getting long-term impact, not just, you know, short-term impact of the interventions. And yes, we believe in nudging, but we are also after the bigger questions that are beyond just doing small tweaks, but actually changing systems as well. And finally, how do we get the government 2.0 and policymakers, and how do we get them to further adopt behavioral science and also reduce their own biases and barriers to designing better programs? So I think I spoke much more than the allotted time. I apologize, but I can stop now and we can maybe have a discussion.
Hi, Zeina. Well, thank you so much for the talk. I mean, it did prompt a lot of potential questions. I will. I'll allow people to make to ask questions in the chat. They can ask in Portuguese, and then we translate. But we do have a few that we would like to start with, just to encourage. I mean, you did a very thorough overview on all the aspects that could influence the vaccination or non-vaccination and even the post-vaccination behaviors. One thing that I got, one question that I have is that it's getting clearer, perhaps more so in Brazil than in other countries, that at least in the first few months, there won't be enough vaccines for everyone. So there needs to be some sort of prioritization and some sort of allotment. And you mentioned that one of the targets of the World Bank is actually to ensure that it's done not only safely, but fairly. So what are the challenges that you guys, that you're foreseeing and perhaps solutions that you are foreseeing in the communications with the beneficiaries, so that the sense of equity it's not lost, given that COVID has highlighted so many inequalities that we have in so many societies.
So I think what we're seeing some countries do really well is communicate how they are prioritizing. So, saying first that, health workers are going to be the first in line, and also essential workers, are going to be first in line. And then, the decisions whether, elderly, the most vulnerable population. So who are the most vulnerable populations? So elderly, age 75 plus or 70. So these are all basically considerations that governments are taking based on how much vaccine they have by when, and who are the most vulnerable people. But they're also taking into account who are the spreaders. So another way to look into it, who are the people most likely to spread the vaccine, and how do you include them into the prioritization? So this is definitely a country level discussion, and you start seeing the US and then the UK and other countries are basically communicating clearly how this decision is being made and why. So I think that's the first thing, and that's what's going to happen right at the beginning is because there's not going to be enough vaccines for everybody. The question of fairness is an important one, especially because people with means might buy wanting to buy the vaccine, which is going to take away dosages from people who can't. And I think Cass Sunstein in a webinar from Monday, I think, or I think it's Cass Sunstein, was saying, well, if we know this is going to happen, if there's going to be a market, why don't we use that market to actually fund, to make sure that we're able to buy the more vaccines for the more vulnerable people who need to have access to it, who will not afford to buy it. So if you know that it's going to be a market, use that market and build a system in it to make sure that you're leveraging that market to be able to buy the additional vaccines needed for people who may not be able to afford it. So that's some of the interesting conversations happening right now around how do you mitigate kind of that the paying market that may not be following the prioritization of the vaccines in a way so it's more fair. So again, I mean, I wish I can come and say, here's the magic bullet, here's how to do it, but it's going to be, country by country, and it's deciding like how much vaccines we have by when, how we're going to roll it out. The most important thing is explaining it in clear, simple language for people to understand, and basically what the process is.
Excellent. Artur, do you have a question?
Yes, thank you. Hi, Zeina. Thanks again for your beautiful presentation. You raised a few points, very interesting points about trust. You said about role models, effective messengers, political acceptance. And my question is, do you think it's possible to build some behavior interventions for people who have deep trust issues? I mean, how big of a barrier trust is, and how can we work around it?
So trust has been very interesting. You know, if you look at trust, how COVID has affected trust in government. You've seen in some countries where how governments have responded to COVID and implemented it, and how they've communicated with people have actually increased trust in government. So you've seen some countries where you've seen increased trust in government because of how well they've responded to COVID. And you've seen other countries where it has actually gone the other way around, where people don't feel actually that they are being, they're either not being taken into account, or that the government doesn't seem to basically implement good measures around COVID. So you're seeing both. I think the one thing that I'd like to see and happening is COVID is an opportunity to improve trust, because this is where people don't usually see what the government does, right? I mean, you don't know that they've built this road. You don't know a lot of the work that the government does behind the scene, where all the money goes. This is the time where behavioral science, where the government work is very much, you know, upfront. People see it. It's visible. It's affecting every single person's life. And this is where I think how they respond to it and how they deal with issues when there's increase in you know, resistance to lockdown, and how they handle it, I think is an opportunity to improve trust. And this is where behavioral science can help. How do you design these measures in a way that will promote trust? You know, so that's definitely an opportunity here for behavioral science to work with the government through the process to improve the trust by really designing, you know, good communication materials that speak to people, and designing measures that also that people will accept. Now, for when it comes to the vaccination, for some countries or for some people, it's too late to build trust in government, right? It's not going to happen. And that's why you need to find who are the trusted messengers or agents. Who are the people that these individuals trust? So let's say in the US, a lot of people don't want to take, on Australia, it's religious, then bring those, you know, clergy in to take the COVID test. You know, if it's more around, you know, political, bring the political leaders, whoever are the influencers that these speak to, you want to bring those messengers, not just like in the US. Again, it's great, it's Obama, Bush, and Clinton, but I bet you most people who like Obama, Bush, and Clinton are going to take the COVID vaccine anyway. You know, these are not the people who are most, you know, hesitant or resistant to vaccine. So this is basically why you really want to pick the right messenger and separate. You know, again, COVID is an opportunity to build trust, but at some point, this is not the time. The vaccine is not the time just to push that. How you respond, I mean, it can help, because how transparent you are around the criteria of who gets the vaccine, how well you're communicating about the effectiveness of these help. But to get people to want to take the vaccine, then, you know, if you don't trust the government, then that's not your messenger.
Thank you.
Zeina, we'll probably go back to vaccination in a bit, but I want to touch base on the report that you shared. I mean, you really reinforced the need of a good diagnostics and the careful diagnostics. And so we understood from your talk that it's important to understand the problem before governments or institutions spend a lot of funds or start the agenda of action. Many international institutions are actually able to invest resources, time, and money in the diagnostics per se, but we see that a lot of governments are not able to do so. So in your opinion, based on the findings of the both reports, actually, how do you think we can convince policymakers to pay more attention to the diagnostics phase?
So I think there's I'm really thinking on the spot here. So I really think there's two things. First is find champions. Out of all the government, there are individuals there that are innovative, want to do things differently. find these champions. And that's exactly what we did at the World Bank. We went to the people who are a little bit more risk takers, who like innovation and want to try different things. And then we're willing to go and convince the government to do this. And we had a lot of resistance. I mean, you know, and I think, and at some point, it's not about selling behavioral science. It's about, you know, selling solutions that work. And for example, in one country, so I got, you know, one project lead to agree to let us do behavioral work in Iraq, you know, but then the minister was like, what is this behavioral science thing? What is this system 1, system 2? This is all, I want a program that's going to work. People aren't, you know, coming to the program. And that's exactly when I reframed. I never spoke about behavioral science again. It was more about helping find out why people aren't subscribing to the program and how can we increase it. So really speaking, you know, like getting to the point, finding innovative like champions or innovative people within the government who are willing to team up with you, to take the time to do the behavioral research. And if they don't have the resources and time, then team up with academia. And that's what a lot, you know, the IT did and others, team up with academia, team up with think tanks, team up with consulting firms to basically kind of help with the capacity to do the research. And then 3, you know, it's not just about behavioral science. Focus on, you know, you're here to solve problems, and behavioral science is just another way to help you identify what the problems are. And another thing is, so that's basically to kind of get the door open. Another way to do it is, you know, help do the diagnostics separately. So if you have great programs, you know, university programs, aspiring behavioral scientists, you know, volunteer or focus on problems that are happening in public policy. Focus on, you know, programs in cash transfer or whatever it is. There are current issues. You know what the problems are. You know, do you focus your research on it? Team up with them to do the diagnostic, the research in that area to be able to support them, basically to take the findings and basically hopefully change the design of the program. So these are great opportunities when you don't have time, you don't have money, to be able to bring all of the parties together to solve this one problem. And then eventually promote these results. What's really helped is the promotion of how behavioral science has helped this service, this program. That's really important. People like to do what other people are doing. You know, we know that. So copycat. So people are, you know, so showcase where behavioral science has actually been successful at addressing problems. And that's one of the good things about the first report we did, is that, you know, people had an example. Look what this country is doing. Look at what that country is doing. And that's exactly why we did the second report, is because we started seeing, you know, WHO asked us, how did you set up behavioral science? How do we convince this before COVID? You know, and we put this report in mind organizations like them on how to basically set up a unit and why they should.
Hello, I'd like to ask a question related to that topic. Is it okay?
Sure. Go ahead, Flávia.
Okay. So first, thank you, Zeina, for your talk. It was quite interesting. I was wondering, just as you mentioned that what kind of behavioral intervention works in a certain challenge in a country may vary from country to other. I was wondering whether this would also happen within a country. So for example, in the tax compliance example that you mentioned, if I send a certain letter with a principle to citizens, it may not work the same with companies. And what I was going to ask is, in this diagnosis phases, how do you identify the correct level of segmentation, and how do you know if there's one behavioral determinant or more than one, and how are you actually applying this? And in your experience in multiple countries, how is the field segmenting it and designing multiple interventions depending on the public and depending on behavioral trait? And is the public sector mature enough to have, in terms of data and infrastructure, to actually be able to segment it, to send, for example, different letters according to a different citizens' characteristics or things like that?
That's a great question. So definitely context, you know, matters. So even, you know, for us, it's even at we definitely segment a lot of our interventions. And one example is the tax compliance. I'll go back to that. So people with people with high income react differently than people with lower income. People with we actually, even people from different communities, areas may react differently than others. So we definitely see different behaviors, and that's why different messages work differently with the different audiences. And that's very important. That's where testing helps. Testing, where you're able to test these messages, allows you to figure out how is this segmented? How is it that what are the different groups that you have? Who are these people? What's similar around these individuals reacting to this message versus these not reacting to that message? So that's the beauty about the A/B testing, or just doing the RCT, when you can quickly test messages, or whether through phone or whether through emails or social media. But also when you're doing the behavioral diagnostics, you start kind of understanding, and you come up with your own assumptions of what are these different groupings. But until you actually do the testing, you don't really know if these groupings are accurate or not. We try to use personas a lot from human-centered design in kind of creating and explaining the different profiles of individuals that could be facing this problem. But again, I mean, these are fictional individuals that we create based on certain characteristics. But again, until we actually test it, these are just assumptions. The testing will allow us to know. And we do that a lot. A lot of our programs, we end up modifying based on the audiences and the grouping, the intervention. So on data, yeah, sometimes they have data. Like we have a great program with Kosovo on the tax administration, and they have great data. And actually, when we did the first intervention with them on tax compliance, they realized like a large number of their data was incorrect. So the nice thing is that the behavior or incomplete. So the behavioral intervention allowed them to focus on correcting and updating their databases, because they realized a lot of the information actually was incorrect. And now they've been doing different type of testing of messages around taxes based on the different audiences. So again, I mean, one advantage is a lot of this work ends up requiring identify issues with the admin data that governments may not be aware that they have.
Great. Zeina, Clary from ENAP has a question in the chat. He says, you mentioned that behavioral science should also be applied to big problems. So, and in that context, what lessons coping with COVID can bring us to deal with issues like global warming and inequalities, for instance? How can we leverage that?
Definitely. I mean, when you talk about climate change, which is a huge crisis that's invisible for most people. I think with COVID now, as it is a very vivid crisis, we're kind of getting ideas of what works, what doesn't work. I think the only difference is people do not easily relate to issues like around climate change, for example. So I think what COVID has, the contribution COVID has had to behavioral science is that it's really strengthened and consolidated a lot of our, how do you respond to crisis, and how do you respond, this is a health crisis, but I can see us leveraging this for, disaster crisis as well. So I think that's one advantage of how COVID has been an opportunity for behavioral science as well. But again, I mean, for bigger issues, there's, I think the whole kind of, most of us have put a lot of our extra work on hold, and everybody's focusing right now on COVID. But I think there's been really already interesting work around, kind of big problems. We're doing a lot of research on social cohesion ourselves, as we think that this is one of those complex big problems in fragile countries like Iraq, Lebanon, and seeing how do you leverage behavioral science. There's not a lot of still evidence and research, still very much early on. But definitely, I think COVID has raised the profile of behavioral science in the eyes of government, of international organizations. That I'm hoping that after this, people kind of get used to seeing, how can I use behavioral science to solve this big problem? It's no longer like a nice to have, but it becomes kind of like one of the expected tools in policy making. And it's our job to make it easy for them to see that behavioral science has supported in the COVID response, is able to support COVID response and other problems. And how well we communicate about that is going to be what makes a difference. Mm-hmm. So I put the burden on us.
Great. Zeina, just getting back to the vaccination topic, because it's becoming very, very urgent here specifically. One thing that and I would just like to hear your thoughts is that it's among the populations, they are more resistant to vaccination. I mean, there is a share of it. There is actually a set of beliefs or which could be qualified as rational or semi-rational, semi-system 2, as you mentioned with your the doctor examples that you mentioned. That well, that specific vaccine, I mean, he's kind of leverages some information that he has. So he's using information.
It's a she, by the way.
Okay, sorry.
I just
my take, and I have this morbid trend to watch some given Latin American present Twitter followers. That a big part of it is actually an identity thing. So it's less about the vaccine, it's more about the group that I belong to, which seems to me very hard to break. I mean, but on the other hand, anti-vaccination, it's not new. Anti-vaxxers, or established practices on their realm. Because we probably need it here in Brazil.
I'm sorry, you got a bit disconnected, so I didn't hear the last part.
So, I mean, whether there, I mean, given that that necessity of sort of breaking or carving that behavior out of an identity system, whether there are good, even from other domains, for instance, extremism research, or other strong identity type of identity related behavior that could help us get through some of those groups?
So there's been a recent development in the moral theory by so the interesting work there is by Jonathan Haidt. He has a great book on righteous mind, and this is more targeted the US, basically saying here's the liberals follow these two, there's these 5 sets of values, and conservatives, value each one of them, liberals only care about 2. So I think it's really interesting. And then if you really want to target, for example, conservatives, you got to target the value system. You cannot say only, public good. You have to use the vaccine because it's good for everybody. That's not going to work for them. You have to use on what is it? It's an American thing to take the vaccine. You're being a soldier. You're being, you want to use, like you saw with the Montana example, you want to use visuals, examples, identity that people see themselves in it. You cannot use the same messages you would use with others who are just going to be okay to take the vaccine because of, it's enough to tell them it's going to be, you're protecting other people. You need to use different kind of messaging for those that who have a much more like a different value system. You want to use, for example, the loyalty aspect. You're being a loyal part of your community by taking the vaccine. You want to adhere to their other value systems. So the question is, when you look into these communities that tend to be, anti-vaccines, what are the values that are important for them, and how could you craft a message that speaks to those values? And then again, who's the right messenger?
Perfect.
So.
Guilherme, can I make a quick question also?
Sure.
Hi, Zeina. Thank you very much for your talk. It was amazing. And you mentioned and made us curious about the framework that you are developing in the World Bank. I remember when in the World Development Report in 2015, that we didn't have almost anything. And even the idea of thinking socially, individually, and the mental models helped a lot. People that were starting to study this area. So can you tell us about a little bit more about this framework? If you have already know when you're going to be launching?
Sure. So this framework, we plan on launching it in around June, basically in June. It started off because we've done this behavioral diagnostics in Mexico to see how to encourage women, indigenous women, to take up grants that helps them start businesses in natural resource management to protect the forest. So we did this behavioral diagnostics, and then we've had other countries, and then we did an intervention, but we had other countries who wanted to do the same thing. So we got funding to basically create a toolkit to help people who want to identify what are the barriers to basically, how do you do behavioral diagnostics for a program. And also for us, because as we were basically being formed as the team, each of us had our own approaches. So what the team that's actually working on this framework, they actually did kind of a review of, interviewed all of us to basically see the different methods we use in doing behavioral diagnostics and what works, what doesn't work. We also reviewed other frameworks out there on the diagnostics. So it really looks into, a kind of compares other frameworks, what's good with them, what's missing, our own basically way of working, and then also walks you through on each stage on how you actually, from problem definition all the way to getting to think through solutions. So really, so really focusing a lot more on kind of how do you do the diagnostics, and when do you decide what to do, and what kind of field work to do. What are some things to take in consideration when you're going to do field work as well?
Oh, so nice. I remember when we talked, you mentioned that a framework could help a lot also for us to apply more, in all these countries, Latin America, and I'm sure it will help all of us here. Nice to hear. Great.
So hopefully
Great
we can
news.
come back over the summer and present it to you guys.
Perfect.
It's a plan.
Yeah.
Juliana will make sure it happens. Yeah.
I saw the dates, June 2021. Yeah. So for July, tickets. But let's buy the tickets. Hopefully.
Sounds good.
Zeina, I would like to tackle a different topic here. You talk about working with local expertise, which is very important. And also you talked about growing global network. And I wonder, how can we relate this to tackle the weird problem in behavior science, Western, educated, industrialized, rich, and democratic? And how can local organizations help to develop and deploy local expertise so we can avoid building on an exclusive weird knowledge database or something like that?
It's you guys. It is communities such as you. And not just community, just as you guys, connecting internally, but also connecting externally. I mean, I think what you see, I'm very active on Twitter, less on other social media channels, but you see a lot of the Middle East, for example, consultants and researchers pushing their work. You see that as attending different conferences. So really putting yourself out there so people know that you're there. Same thing, I think the behavioral scientist a newsletter covered like the South kind of how the South is leveraging behavioral science. Putting you guys out there, like publishing your work, getting into forums to talk about it, letting people know, but it's you guys, and do anything, just start doing behavioral work experiments and going and talking about it internally, but also externally. I think that's what you want to do, because people don't know. We had to actually kind of go on mission to Brazil last year to get to meet most of you and to know that there's this amazing community in Brazil that's, doing great behavioral work. So I think that's kind of what you have to do, is really put yourself out there and promote yourselves as a community externally and showcase each other's work as well.
Yeah, thank you. Hopefully we can achieve that.
So hopefully next time we connect, you have a Twitter account where you are promoting the different works.
in June, right?
In June, yes.
Okay, perfect.
Yes.
Great.
So Zeina, maybe our last question today. So I want to go back to the reports, but I want to take advantage of your last response, which was very inspiring to us. So we had the volume 1 2 years ago, and now volume 2. Since volume 1, what do you see as an evolution of the field? And what aspects you see have improved and which ones need a little bit more effort? So we can forward look to 2021 and think of us as individuals, behavioral scientists or behavioral sciences lovers. So we can relate and try to, help in some way to promote the field in the next few years.
So reflecting on where countries are now after years, so in some ways you've seen countries that had good teams. One thing that happens when you have teams is, especially if it's driven by one person, is when that person leaves, the work may changes. And what I've seen really work well is when there's been a solid team, and when the person who's kind of pioneered that team left, the work stayed and expanded. And I think what's been nice to see is that, and I was always worried about that, because if you've seen, like I was always asked at the beginning, is behavioral science is a fad? Is it just like, the flavor of the moment, and then, in a few years it's going to go away? That was kind of like what the expectations are for behavioral science. And definitely seeing how these teams have really anchored themselves and are here to stay in the different organizations and governments is really demonstrating that, behavioral science is becoming the way of doing business. I think the challenge we all face is that there's not enough of us to tackle every single opportunity there is in behavioral science. There's never going to be. So how do you extend that? And how do you get others? Like, there's no way in the World Bank we are going to be able to support. Behavioral science can support every single project at the World Bank. There is no way we're going to ever be able to do it. Never. So how do you actually expand and scale up behavioral science in the organization, in the programs, in a way? And that's why we look into, for example, as programs mature, like around tax compliance, can the World Bank tax unit take over the whole thing? We're not longer working on tax. There's been kind of best practices with do's and don'ts and guidelines, and we can transfer that knowledge. So we're going to start seeing a lot of maturity within, like, in education. Once there's been enough experiments to see these fields, these areas where then you don't actually need to be a behavioral scientist to implement this. You already know from the evidence what works, what doesn't work. And as an education expert, I'm up to date and I can implement it. And the same thing from, people, a lot of the economists right now are studying behavioral science, which is also going to help change, how people apply design programs in their governments or in their organizations. So I think that's something where I'd like to see us go, is where we're able to kind of finalize certain business lines and transfer them to the actual experts of those areas for them to actually implement and transfer some of the knowledge. So I think that's one where we want to see behavioral science go. I at the beginning, when people ask me this question, I used to say I want to see myself out of a job, right? That behavioral science is so well integrated, you don't need someone like me. But I think you always need people who are going to try to leverage different tools to solve problems. So for me, is leveraging behavioral science, but also IA, artificial intelligence, machine learning. There's just so much more we could be. Human-centered design. There's just so much more out there that we could be kind of leveraging to help design better policy, public policy. And that's something I want to see. I was very happy to see that the BIT, one of the BIT folks, principals, I think Michael, wrote about how we should be integrating more human-centered design in behavioral science. A few years ago, this was not something that people were open to because they felt that these are different disciplines. So how do we actually, try to start converging and leveraging all of this, these technologies? And maybe we're not going to be called behavioral science. Maybe it's going to be called something else in the next 4 or 5 years. But that's basically kind of like where I'd like to see the field mature. Yeah. I hope I answered the question, but that's.
You did.
Okay, good.
Very inspiring answer, actually, which leads us to a very inspiring closing. So I want to take this opportunity, Zeina, to thank you again on behalf of Artur, Guilherme, Flávia. Of course, if you want to say anything, please, you three, be free to speak. But thank you very much. It was really inspiring. It was really interesting to hear your thoughts on the report, your thoughts on what the bank has been doing on COVID and looking forward with the vaccine, the surveys. Thank you very much. We hope to see you again in June then.
I hope
Thank
so
you, everyone who took the time to be here and also be inspired by Zeina's words. And hopefully, we have once again in our front 2021 coming up with hopes up and fresh starts for everyone. So thank you very much.
Thank you so much for having me. I really enjoyed this, and you guys asked really good questions. And hopefully next time we come, we can share with you what we did on COVID vaccination. So we'll have hopefully some examples and how this work has developed. And I wish you all Merry Christmas, Happy New Year, and I'm sure we'll see some of you guys soon.
Great.
Zeina, thank you very much again. It was amazing. Oh, sorry, Guilherme.
Please go.
It was very nice, and hopefully also you'll be soon telling about the Brazilian experiments and more Brazilian projects. So it was very inspiring to meet you last year. I think for the whole year that was so challenging for us this 2020. So hopefully we'll be closer in 2021 before June. Let's have that, and hopefully in person in June or July to talk about the framework. So thank you very much for the inspiration for us and helping us out here in Latin America and everything. I know you have been working on that to help us also grow the subject here in Brazil.
Thanks, Flávia. And also Flávia was the first person, actually, one of the first people I've met who worked in behavioral science in 2015 through social media. So
perfect. And yes, we were just calling each other, and I made the invitation. And I'm being very sincere about this. Last year, Juliana knows it was very inspiring talking to you all, showing all the work in details, discussing about the behavioral map and other things. And frequently I talk about the work that you are doing there. So thank you very much. It helps us a lot.
Thank you.
So Zeina, we started a tradition with the virtual meetups this year, which is everyone opens up the camera and turns on the camera one so that we can have a picture or actually a print screen, so that we can share with you later.
I love it.
So please, everyone.
I'm gonna take now because there was a message in front. So let's do it. I usually take the picture, but let's go. Thank you.
So Happy New Year.
Yes.
Happy New Year. Thank you very much. Thank you, everyone. Obrigada a todos aí, né? Bom ver vocês aí nesse último meetup, né, Guilherme?
Sim.
Bye bye.
Até o ano que vem, pessoal. Thank you so much, Zeina.
Thank you. Bye.
Thank you.
Thank you, Zeina. Thank you, everybody.
Até o ano que vem, pessoal.
Para todo mundo, Feliz Natal, boas festas. Cuidem-se, ano que vem. Continuemos.
Todos.
É isso aí.
Amém. Bom vê-los, gente. Clara, Henrique, Petros.
Prazer enorme. Thank you so much.
Um abração.
Abraços a todos.
Beijo. Tchau, tchau.
Encerrando a gravação.